want to introduce myself. My name is Samantha Hernandez, and I am the Healthy Climate Program Director here at Oregon Physicians for Social Responsibility. And I'm very excited to present to you all this webinar. Today, we are going to be learning about the health benefits of electrification and resources to make your home more climate resilient. And I'll now be speaking in Spanish for our Spanish-speaking folks. Bienvenidos a todos. Yo me llamo Samantha Hernández y soy la directora del Programa de Clima Saludable de Médicos por la Responsabilidad Social de Oregon. Y hoy vamos a aprender sobre los beneficios para la salud a la electrificación y los recursos para hacer su hogar más resiliente al clima. And so a little bit about Oregon PSR. We are an organization of health professionals and public health advocates working with allied organizations and frontline communities. We use science-based expertise to build movements that drive systemic change on multiple levels, local, state, and national and international. We seek a healthy, just, and peaceful world for present and future generations. Entonces quería hablar un poquito sobre nuestra organización, Médicos por la Responsabilidad Social de Oregon. Es una organización de profesionales de la salud y defensores de la salud pública que trabajamos con organizaciones y comunidades. Utilizamos la ciencia y la experiencia basada en evidencia para construir movimientos que impulsen un cambio sistémico. Buscamos un mundo sano, justo y pacífico para las generaciones presentes y futuras. And so I wanted to really quickly go over some instructions around how to access the interpretation. So as you all know, this is a bilingual bilingual webinar where we will be offering it in English and Spanish. And so how you access the interpretation, if someone speaks in Spanish and you would like to understand what they're saying, you click on the globe icon that says interpretation located at the bottom right of your computer screen. For some folks, it's not showing up. You have to click the icon with the three buttons that says more, and then you'll find interpretation, and then click English to understand when folks are speaking Spanish. Para las personas que hablan español, si quieren acceder a la interpretación, haga clic en el icono del globo terráqueo que dice interpretación situado en la parte inferior derecha de su pantalla. Y hay una foto aquí. Algunas veces para algunas personas tienen que hacer clic en un icono que tiene tres puntos que dice more o más y después haga clic en Spanish o español. Alrighty. I am going to go ahead and start with our first presenter, Melanie Plout. Melanie Plout, MD, delivered thousands of babies in the Portland and Vancouver area and retired from her OBGYN practice in 2016. She has worked since then on issues where climate and health intersect. And today, Melanie will be talking about the health benefits of electrification. And let me pull up those slides and share my screen.
So the view I'm seeing, Samantha, is not the full screen view, it's the working view.
Oh, okay. Let me
There we go.
Alrighty.
Thank you very much. And we can go to the next slide. So I'm going to talk today about the health effects of methane on several different levels. I'm going to talk about indoor pollution, which comes primarily from gas stoves, outdoor pollution, which because they are vented to the outside, are primarily involved with outdoor pollution. And then three things that you only get with methane and not with electric appliances: explosions, carbon monoxide, the risks from fracking, and then I'll talk about the health risks from global warming. Next slide. So gas stoves are the only appliance that's vented indoors. And we spend 90% of our time indoors. So this is an important thing to know about. Next slide. Just to be clear, any kind of cooking does create some air pollution with particulate matter, which is why you should always use a fan when you cook. And with any luck, you have an effective one that ventilates to the outside. But with gas cooking, you get some additional things that you don't get with electric or induction stoves. First of all, you get an increase in the amount of particulate matter. Secondly, you get nitrogen dioxide, and sometimes you'll hear us refer to this as NOx, which is the combination of the different nitrogen oxides. So NOx doesn't come directly from methane, but it is formed whenever you burn something at high temperatures and the nitrogen in the air is combined with oxygen to create the NOx. So this happens, for instance, with car exhaust or with many industrial processes. In addition, because natural gas or methane is contaminated with things like formaldehyde and benzene, which are known cancer-causing agents, you get these not only when you burn the methane, but they are also emitted 24/7 in small amounts because all stoves have small amounts of methane leakage. Next slide. Getting back to NOx, the effect of NOx on health has been known since the 1970s because it is a major component of the air pollution that our cars create. I was a little bit afraid that this knowledge might have been wiped off the federal websites, but when I last checked, it was still there. So respiratory symptoms have been linked to gas stoves for years. Some of these studies have been criticized by the gas industry, but you have to remember that given what we know about the effect of NOx, it would be unethical to intentionally expose children or adults to these substances to see what the effect is. Next slide. You may have heard this, that asthma is the #1 chronic disease in children. And a review of the literature that looked carefully at 41 studies found that there was an increased risk in current asthma symptoms and an increased lifetime risk for the diagnosis of asthma in children who live in a house with a gas stoves. Next slide. So as I said, we know a lot about NOx and how bad it is for us. It's bad for the hearts and lungs. It increases cancer. And it's also been implicated in adverse pregnancy outcomes. It also affects our brains. It has been associated with Alzheimer's, teenage depression, and bad calls by umpires. Next slide. Lower income and people of color are at higher risk from gas stoves since they are more likely to live in multi-generational families, more likely to live in smaller homes and apartments, and their appliances may not have adequate ventilation and be properly maintained. Next slide. They are also more likely to live in places with more outdoor pollution from adjacent highways or industrial facilities, and many of these populations already have an increased risk of health conditions like asthma. Now, the gas industry will often emphasize the importance of ventilation, and this is true. But the fact is that fans are quite noisy, and so it's no surprise that a California survey showed that over half of people don't use them routinely. And many fans, like those that are a microwave above the stove, really are useless. They're just recirculating the air in the kitchen. Next slide. So there was an interesting study done in Baltimore that directly addressed this. They took families who had gas stoves and they randomized the groups to one of three different interventions. Either they gave them a hood and a proper hood that vented to the outside, or they put in a carbon filter, or they gave them an electric stove instead of the gas stove. And the only intervention that really decreased the NOx was replacing the gas stoves with electric stoves. Next slide. Now let's talk for a minute about outdoor pollution, which comes, as I said, from gas furnaces and water heaters. The California Air Resources Board announced a requirement, I guess it was last year, that air and water heating that's sold as of 2030 will need to be zero NOx. And basically, that's a ban in this area of California on those gas appliances. Next slide. They estimate that with this move, there will be hundreds of fewer deaths in the state each year and a big savings in healthcare costs. Next slide. Now to get to those sort of three bonus risks that you get with methane gas, or what we sometimes call natural gas. So this picture is from an explosion that occurred in 2016 here in Portland on 23rd Avenue when a gas line was damaged during construction. This explosion injured 8 people and caused over $17 million in property damage. These kinds of explosions, they're not common, but they're not rare. And if you follow the news, you will see them happening across the country with some regularity. Next slide. The next risk that you get is carbon monoxide. Now, there is no known safe level of carbon monoxide, and even chronic low levels may be harmful. The only reason we need to have carbon monoxide detectors in our homes is if we're burning anything. So if we're either have a fireplace or a natural gas heater or stove, you need to have a carbon monoxide detector. And in 2024, over 1,000 people died in this country from carbon monoxide poisoning, and most of those were accidents, not intentional. Next slide. The other thing to remember is that methane or natural gas comes from fracking. Now, we don't have fracking here in Oregon, but almost all of our natural gas does come from fracking in other states. People who live close to fracking sites have an increased risk of poor health outcomes, like premature birth and childhood leukemia. Next slide. And finally, we need to talk about the climate. So methane is a very strong greenhouse gas. But the good news is that it has a shorter half-life than carbon dioxide. So anything we can do to reduce methane can more quickly decrease the global warming that we're already seeing. Next slide. One of the big effects, of course, of global warming are these heat domes. And I'm sure many of you remember the dome in 2021 that caused 72 heat-related deaths. Next slide. Climate change, of course, also increases the risk of wildfire. And we are learning more and more about the danger of the smoke from wildfire, which comes to us even if we live far away from where the fire is, because everything we burn, we breathe. Next slide. So there are a lot of electrification benefits. One benefit is to our planet. And if we switch to heat pumps, we can significantly cut climate pollution from the average Oregon home by 84% over the lifetime of the equipment. Next slide. And then electrification also in the long run benefits our wallets, although there are some costs up front. Overall, it should result in system-wide savings. The installation of a heat pump has been demonstrated to increase home values. Next slide. And for most people, it will save money on long-term utility bills. It's also cheaper to build a home that's all electric than to build one that has both gas and electricity. And then finally, electrification of homes and businesses will result in significant health cost savings because of all the things that I've talked about up to now. Next slide. So in summary, there really isn't any controversy. We know that NOx is bad for our health, both indoors and outdoors. And just as an aside, if you burn something else, if you substitute hydrogen or biological gas instead of the fossil gas, that doesn't change this. And then there are these special risks like explosions, carbon monoxide poisoning, and the risk to fracking. Electrification is clearly much safer. And then finally, of course, burning it and the leaks of unburned gas lead to climate change. So a rapid decline in methane use would have climate benefits, economic benefits, and health benefits. And I think that's it.
Thank you, Melanie. That was so great. Always a pleasure to have you present about all of those health impacts.
Thank you.
Now I want to present our second panelist, Bryce McManus. He is an incentives analyst for the Oregon Department of Energy, where he focuses on education and outreach for energy incentive programs. He also helps manage and maintain the Energy Hub for incentive programs and projects in Oregon, a website that connects Oregonians with information about available energy incentives. I'll hand it off to you, Bryce. Thank you.
Thanks, Samantha. Just give me a second here to share my screen. Okay. Can you see the presentation? Yeah. Okay, cool. Great. So yeah, my name's Bryce McManus, and I'm an incentives analyst for the Oregon Department of Energy, as Samantha said. And for today, for my talk, I'll provide an overview and an update of state incentives and state programs that support home energy upgrades and electrification. So first, before I get into the programs, I just want to share the Oregon Department of Energy's mission statement. So here at ODO, as we call ourselves, our mission is to empower communities with knowledge and resources to support a clean, equitable, and resilient energy future, balancing affordability, environmental stewardship, and long-term sustainability. So here are some things we do at the Oregon Department of Energy. In summary, we serve communities statewide by delivering trusted energy data, offering expert guidance and technical support, overseeing energy regulations, and managing programs that address Oregon's evolving energy needs, which I'll be talking about shortly. Okay, so I'm going to be talking about 3 different programs today. And the first of which is the Home Electrification and Appliance Rebate Program, or HERE. So HERE is a program funded by the US Department of Energy through the Inflation Reduction Act. Back in September of 2024, ODO received an award for the Homes in HERE programs. The total was 113 million, and that's roughly split between the 2 programs. So HERE is one of those 2 programs, and it provides a point of sale rebate for eligible appliances and upgrades to low and moderate income single family and multifamily households. So by point of sale, that just means that you receive the rebate savings up front instead of having to wait to get reimbursed later on. So as its name suggests, it's an electrification program. So the rebates here can only be applied to first-time electric appliance purchases or to replace non-electric appliances. So if you have a gas stove and you want to upgrade to a energy efficient electric stove, that would be eligible under HERE. If you already have a high efficiency electric stove and you're trying to replace it, that would not be eligible under the HERE program. So there are a list of eligible appliances and upgrades for the HERE program. I just mentioned one, electric stoves, but heat pump water heaters and heat pumps for space heating and cooling are also eligible. And there are eligible upgrades to help make sure that you can install those appliances. Things like electric panel upgrades to handle the increased load, insulation and air sealing measures to make sure that you maximize your energy efficiency, and also things like smart thermostats that help you monitor your energy usage more efficiently. So each appliance, eligible appliance, has a maximum rebate amount. So for example, if you are interested in a heat pump for space heating and cooling, the maximum rebate you can receive for that is $8,000. And so each of those upgrades and appliances has its own maximum rebate amount. So the program will cover 50 to 100% of your project costs up to a maximum of $14,000. So it's a pretty high limit. That depends on your household income, however. So low income households can have 100% of their costs covered, while moderate income households can only have 50% of their costs covered. And I'm happy to define what low income and moderate income means later on. So the other half of that home energy rebate program offered by the US DOE is the Home Efficiency Rebate Program, or HOMES as we call it. HOMES is a performance-based rebate program, and it's for energy efficiency home retrofits. So what that means essentially by performance rebate or performance-based is that the rebate amount depends on the energy efficiency improvement that you're able to achieve through your project. The project has to have a minimum 20% efficiency improvement to be eligible for a rebate. And if you are able to achieve a 35% or greater improvement, you can get an additional bump in rebate. So the HOMES program is for both single family and multifamily households. And it's also open to low, moderate, and high income households as well. So HOMES doesn't specify a list of eligible upgrades. As long as a project meets the minimum 20% efficiency improvement threshold that I mentioned earlier, that upgrade is eligible. So some examples of projects that can realistically achieve that are things like heat pumps and weatherization measures like insulation and air sealing, um, energy savings devices like smart thermostats. Those types of measures are typically what homes will cover. However, there isn't a specific list of eligible upgrades. The rebate amount for homes depends on three factors. So there's whether the project meets or exceeds the minimum efficiency requirement. There's also whether the household is low income or not, and whether it is a single or multifamily household. So there are different incentive amounts that each of those groups are eligible for. And so you can imagine it's a little bit of a complicated table to show all the different scenarios there. But similarly to the HERE program, there are like there's a limit to the amount of rebate you can receive. So low income households can receive a maximum of $10,000 or 100% of the project costs, while moderate and high income households can get a maximum of $4,000 or 50% of their project costs covered. And before I continue, I will mention that these programs haven't opened yet. They are still in development, and we expect them to launch early 2026. So keep an ear out for that. You can sign up for email updates on our website, and I'll have a link at the end of the presentation that you can look at for that. So the last program I want to talk about before moving on to a general energy resource, which Samantha mentioned in my introduction. So the last program I want to talk about is the Heat Pump Purchase Program, or HP3. HP3 is launched in June of this year, so it's a very recent program. It provides a $2,000 incentive for installing heat pumps in Oregon homes, and there are three eligible categories. There are owner-occupied homes, there are rental properties, and new construction. All three of those categories are eligible. There aren't any income restrictions for HP3, and the only main restriction is that there's a limit of one incentive per residence. So at the moment, the owner-occupied category has been fully reserved due to high demand. It's been a very popular program. However, the rental and new construction incentives are still available, and there's a second round of funding in 2027 that will be opening up. So the last thing I want to, sorry, I moved on to the slide. Okay, so the last thing I want to talk about is the Energy Hippo website. So Energy Hippo just stands for the Hub for Incentive Programs and Projects in Oregon. It's a website for homeowners and renters and property owners who want to learn about home energy efficiency projects. They can go to this website and learn about energy efficiency projects and potential incentives they may qualify for. So there are two parts to the website. There's the general information piece, and then there's the incentive finder tool. The informational side of it, you can learn about DIY projects for improving energy efficiency in your home. There's information on how to choose the right heat pump for your home, and also how to navigate selecting a contractor for a home project. And there's a lot of other information as well. The incentive finder tool it's really easy to use. All you have to do is enter your information like household size, income, and zip code, and the tool will show you incentives that you may be eligible for. So that includes state programs, federal programs, your local utility, and other incentive providers. And you can filter those results by the upgrade type that you're interested in. So if you only want to learn, look for heat pumps, you can do that. Or if you're interested in an EV charger, you can filter for that. So it's a really great tool. It's a great resource. And the last thing I'll mention is that it also has a translation feature for the website. So if you're not an English speaker, you can go up to the upper left-hand corner of the website and select your preferred language. And yeah, that's it for me today. Thank you so much.
Thank you, Bryce. That was very informative, and I'm definitely gonna look at that website. Alrighty, well, I want to present our third panelist, Abraham Rodriguez, who is the Community Engagement Specialist with HealthShare of Oregon. Prior to starting at HealthShare, Abraham operated as a CHW in the intersection between agriculture, school, and primary care case management at the Benton County Health Department. And with that, I will pass it to you, Abraham.
Yeah, thank you, Samantha. Let me see if I can share my slides. See them there. Okay. Is everyone able to see the presented view?
Yeah.
Perfect. Yeah, so hi everyone. Thank you for having me. Again, like Samantha said, I'm the community engagement specialist with HealthShare of Oregon. So that is who I will be representing today. Although I do want to say that the two programs that I'm going to be primarily talking about today apply across the state. So it's not just specific to the region that HealthShare serves. Okay, so this is going to be kind of the overview, the main three things that I'm going to be talking about. Number one, I'm just going to give a little bit of background on what HealthShare is and talk a little bit about the CCO model, just because it is essential to understanding how to apply for the benefit that I'm going to be sharing today. And then number two, the main benefit that I'm going to be talking about today is the health-related social needs, climate, and weatherization program. And then finally, I'm just going to be talking about some changes and federal impacts to the Oregon Health Plan, just because I know that there's a lot of talk about that right now. And I'm trying to be mindful to speak slower because I know there's interpretation going on. So I'm gonna try to pace myself as I'm going through this. Okay. So what are CCOs? So CCOs are coordinated care organizations. CCOs really just people can think of us as the actual health insurance plan for people that have OHP. HealthShare of Oregon is a nonprofit CCO that serves the Tri-County region and the metro area, which includes Clackamas, Multnomah, and Washington counties. Most people that have OHP will be required to be part of a CCO. And depending on which CCO they have, the way that they access their medical benefits will look different. So that's why I want to share this background information and then also talk a little bit about our model because HealthShare is a very unique CCO and everyone will be able to see why in the next slide. So the way that HealthShare is unique is that for the most part, CCOs across the state, there is 16 in total. And for the rest of the 15 CCOs, they are their own health plan and they employ their own health networks. Whereas everyone can kind of see here like the separation of levels for like between the Oregon Health Authority and then HealthShare, and then various health networks that I'm sure many here are familiar with, or maybe you even work for one of these different health systems. So the way that it works is that HealthShare is the actual CCO. And what we are responsible of doing is handling all of the oversight and employing a lot of the requirements that we give to our health networks to make sure that everyone that has OHP and is assigned to HealthShare as their CCO is actually receiving their health benefits, and to make sure that we're eliminating as many barriers when it comes to accessing the health services and benefits that our members are entitled to. So with HealthShare, we have a total of 5 different health plans. At any given moment, our members are assigned to one of these physical health plans. And again, depending on which health plan that our members have, that's going to impact a little bit how they actually receive this benefit and what is available to them. And then I also want to just talk about OHP eligibility. Currently, OHP Plus eligibility, which is the basic program that most people know as when they say OHP, is solely based on an individual's income for their determination. And I believe in the next slide, yeah, so this is actually the income eligibility chart. So the way that OHP works is if everyone can look at the 138% federal poverty level column on the left-hand side, they will be able to see the maximum limit that a family or a household can make in order to qualify for OHP. So Medicaid, which is OHP, is for people with low to no income. And again, it's dependent on their household size. So just for reference, people can look at the number of individuals in their household. So let's say someone has 4 people living with them, 2 adults and 2 kids. Their maximum income limit in order to qualify for OHP would be $3,697 gross per month. If they make more than this, there are additional programs that they could possibly qualify for, but the services that I'm going to be talking about today only apply for people that are within that 138% limit. Okay, so now with that background knowledge, a little bit of what a CCO is and the ways that people can qualify for the Oregon Health Plan, I'm going to be talking about the Health-Related Social Needs Program. The Health-Related Social Needs Program actually has 3 different distinct programs under it. There are the housing supports, nutrition supports, and the climate supports, which is the one that I'm going to be talking about today. And they are covered benefits that the people who qualify for them are entitled to receive these services. So it's not a maybe someone could receive this benefit if it's available to them. It's supposed to be if someone meets all of the criteria for this specific service, they are entitled to receive it just as someone else is entitled to receive primary care visits to be covered by their health insurance, and the same thing like 2 routine dental checkups per year. So the way that Oregon has worked this out is so that this is on the same level as those services. The only difference being that the limiting factor for this is the capacity that we have to actually deliver the benefit. And I'm going to be talking a little bit more about that once I get into the eligibility, which I'm going to be talking about next. Okay, so what does the health-related social needs climate benefit actually give? Well, for the people that qualify, they can get air conditioners, heaters, air filtration devices, and replacement filters for those that they might already have or for existing ones. Many refrigerators for medicines that require to be at a regulated room temperature, and portable power supplies for medical devices, such as for people that use electronic respirators or CPAP machines, to make sure that in the event of a power outage during either a heating event or a winter storm, to make sure that they can continue using their medical equipment to stay healthy. And so, in a nutshell, these are the different services that someone can access through the health-related social needs climate benefit. And again, people that qualify are entitled to receive this benefit. And this is the criteria that someone needs to meet in order to actually qualify for this benefit. So number one, they need to be a current Oregon Health Plan member. That one's pretty easy to meet for the population that most of us work with. Number two, they need to have a social health need. So this one is specifically looking at their just ability to acquire these devices on their own. And really, for the most part of the program, it's simple attestation saying that the individual doesn't currently have one of these devices, or maybe their apartment complex doesn't have air conditioning or other devices that the health-related social needs program would be providing. That's usually enough. So it's basically just the member saying that I don't have access to these devices already, so they would like to receive them through this program. And then number three, have some kind of high risk medical condition, which could be either age or any other kind of condition that would make someone sensitive to heat or sensitive to pollution and their environment, or again, like I mentioned, have some kind of complex medical condition, such as severe sleep apnea, or need the use of a respirator or other electronic equipment during the night that would be essential to keep powered, again, during a power outage in the event of a heating event or a winter storm. For people that meet this criteria, they are, again, entitled for this benefit. So they will be receiving the equipment that they need. They can receive one per person that qualifies in the household of every item that is necessary to keep them healthy, basically. The delivery of this program can take some time, but for the most part, we are seeing requests be fulfilled from the date of the that someone fills out the application to the actual delivery within a month. During the times of like high demand, that can be extended just a little bit. Examples are this summer. We had a lot of people apply for our program, so there were some delays in getting people air conditioners, for example. However, we did prepare for that ahead of time, so our capacity wasn't impacted too much. And as we are starting to get into the colder months, we're going to start seeing requests come in for things like space heaters or portable batteries in the events that a winter storm takes out a power line. So ideally, if we are aware that a member needs a device that this benefit provides, we encourage them to apply early before something actually happens. And that's why I'm sharing it with you all today, just so we're aware in case we are working with families that you think would be benefited by this program, to have them apply early. Okay. Yeah, I'm going to talk about flexible services because some people here may have already known about flexible services in the past. Flexible services are a bucket of money that CCOs get from the Oregon Health Authority to kind of decide where they want to put this and invest these funds, and for the purpose of bettering the health of our members. A lot of times, flexible services can pay for things like temporary lodging, supplemental food or kitchen supplies, cell phone and their service plans, gym memberships, basically anything that's supporting their social health as well. And prior to the existence of the health-related social needs program, this was one means that people had access to acquire these items. However, I mentioned this because that's being phased out now that the health-related social needs program is in place, and the health-related social needs program will be funded until 2027. So it's not like that's going away due to limited funds. And I will talk a little bit why it's only until 2027. And really quick, at least for HealthShare members, it's really simple to get access to either of these programs, flexible services, or health-related social needs. In the back of their Medicaid ID card, I've highlighted where they need to call to actually receive this benefit. We recommend calling the individual's health plan. So it's the one that I mentioned where we have the different health networks, either OHSU, Providence, Care Oregon, or Kaiser. So they're going to be calling their assigned health plan to actually get access to this benefit. This program does not require them to ask their doctor or have their physician initiate this process for them. They can do it all themselves. And the health plan is going to be the one in charge of acquiring all of the medical information that shows that they are eligible for this program. Okay, and lastly, I'm just going to talk really quick about the federal changes that are happening in the US. But I'm also going to talk about the current protections that Oregon has that keep OHP as it is until 2027. So there's something called the 1115 waiver, which basically prevents any changes from happening to the Oregon Health Plan as it is in Oregon until 2027. And this is basically just a special negotiation between the federal government and the state to decide special allowances, special waivers, and additional services that we can provide. And our waiver expires in 2027, which means that the health-related social needs program, which is also part of this waiver, is going to stop being funded at that time as well. The state is going to attempt to negotiate for a new waiver. However, with the current decisions that the federal administration has been taking, there are no guarantees for what OHP and the services that we're able to provide is going to look like after that. Something else that's going to be affecting our OHP members' experience are the new proposed rates for CCOs, along with the bill that's known as the HR1 or the Big Beautiful Bill, which is the actual name of the bill. There are new proposed rates that aren't meeting the requirements for a lot of CCOs. This means that we're going to be looking at prioritization of specific services and the downsizing of the contracted networks. Currently, HealthShare does not expect any downsizing of our networks, but we are looking at the possible prioritization of services as the year progresses. And then lastly, there are going to be work requirements implemented, but that's not likely going to come until after 2027. And I think that's mine. Thank you.
Thank you, Abraham. I actually didn't know about the flexible services, and I know someone who would be interested. Yeah, thank you. Now, if folks have any questions for our panelists, you could write them in the chat, raise your hand, however you'd like to ask your question. Yes, Zach?
Yeah, I was at, I can't remember if it was which one it was. I think it was the Women's Day March, and one of the speakers at the Women's Day March had said that Oregon was in the process or potentially moving to a Medicaid for All program. I don't know if there's any if that's true or what's going on with that, or if that's in the works, or or if anyone's heard anything about that, but I had heard about it at one of the rallies I was at.
So yeah, I can speak to answer that. So Oregon is still in progress of trying to create a centralized health insurance for all Oregonians. It won't necessarily be Medicaid for all because Medicaid is something that is matched by the federal government, but rather the state is trying to basically create their own Oregon health insurance marketplace for all residents of Oregon. But that is still on track to happen. And actually, I think they were making pretty good progress. I can get some information to share with you all after the fact, if you would
Yeah, that'd
like
be
to
great.
stay updated on that.
Yeah,
Yeah.
that'd be awesome. Thank you. I appreciate that.
Yeah.
Thank you, Zach, for your question. Super important. Do other folks have questions for our panelists? I actually have one for Bryce. Can you talk about how renters fit into play with these incentives that are available?
Sure, yeah, of course. So I guess it'll be, I'll start with HP3 because that program's actually going on and it has money for rental units currently. So the way that's going to work is if you're a renter and you want to benefit from this incentive, you're going to want to reach out to the property owner and have them uh, reach out to contractors. They can look at our website where we have approved contractors. The property owner is going to need to get a few bids going to make sure they have a competitive bid from our approved contractors, and then the contractor will basically handle the application from there. So renters can't apply directly to the program, but they can encourage their property owners to participate. That's for HB3. For homes in here, it's a little complicated. So, and it's going to be a similar situation for homes. All those projects have to be done by approved contractors, and a lot of those projects involve making changes to the structure or installing like semi-permanent equipment. So while renters, they wouldn't be applying directly, they would also be getting the homeowners to essentially participate in the program. And similarly for here, a lot of that is going to be done through the homeowner. There could be a potential path for renters to do it on their own, but we haven't really figured that out yet. So in summary, contact your property manager or the owner of the home.
Thank you, Bryce. I will do that. Alrighty. Are there any other questions that folks have? No? Oh, Regna's asking, what is the definition of moderate income?
I assume, is that about the energy incentives probably? Yeah, okay, great. So yeah, I mentioned three different categories: low income, moderate, and high income. Moderate income is defined as 80% of the area median income to 150% of the area median income. Follow-up question, I assume, is like, what is area median income? That is determined by the county you live in and the year that we're looking at. So basically 80% of the area median income is defined as, say you have the median income in your county is $100,000, 80% of that would be 80,000. So if you're beneath that threshold, you would qualify as low income. And if you're above that, you would be moderate income. That's not an accurate number. That's just easy math for me to do. right now. So that's basically it. And higher income is anything above 150% of your area median income.
I just looked it up really quickly, and for folks who live in Multnomah County, at least the median income is 83,583.
If I should also mention that we have these tables available on our website. If you look at our frequently asked question for the Homes in Here program, you'll find it linked in there. You can also find it through the Department of Housing and Urban Development. That's where those tables come from. And those are based off of census data. So, but they send us those tables, and we will keep those updated as the program launches.
Are there any other questions? I'm seeing none, so I'm gonna go ahead and wrap us up. Thank you so much to Melanie and Bryce and Abraham, and to our interpreter Carmen for showing up and sharing your expertise, and for Carmen for offering their interpretation. Oh, I just saw a question from Dariana. Can you qualify for a heat pump now for 2026?
Um, so if you're asking if you can apply to a heat pump incentive program now, yes, that you can apply to the heat pump purchase program right now, and that's not income restricted. And like I mentioned, there's the rental and new construction categories are currently have funds. If you're interested in installing a heat pump in 2026, you could wait for Homes in Here to launch if you want to take advantage of that. However, if you have an urgent need to upgrade your system now, we highly encourage you to do that. There are other incentives available that you may qualify for. The Energy HIPAA website, like I mentioned, has an incentive finder tool. If you plug in your information there, you'll see potential other heat pump incentives you might qualify for. And you could stack those incentives. Most programs allow that. So that would be my recommendation.
And I think when the Homes program launches, we'll also share with our members so that they can apply. I'm very excited for that to launch. Alrighty, are there any other questions that folks have? Alrighty, well, it's 7 p.m. and I want to be respectful of everyone's time. Yes, a big thank you to all the presenters and our interpreter, and for you all for attending our webinar. We'll follow up with links and resources as well as the recording. And I hope y'all have a good rest of your night. Thank you. Bye.